Assalamualaikum warahmatullahi wabarakatuh. My name is Aina Rahayu binti Rosli. I'm from SR1134C. Okay, today I would like to share about muscle strain. Okay, the first one is introduction. A strain to a muscle or muscle tendon is the equivalence of the sprain to a ligament. A muscle occurs when muscle fiber cannot cope with the demands placed on them by exercise overload and lead to a tearing of the fiber. It is a contraction during injury in which muscle fiber tear due to extensive mechanical stress. Okay, this mostly occur as a result of a powerful eccentric contraction or overstretching of muscles. Therefore, it is typical for non-contact sport with a dynamic characteristic such as sprinting and jumping. Okay. Strain most common at sport that no contact with other or opponent, like sprinting and jumping. Okay, that's all for introduction. Okay, now we move to what is strain. Okay, strain is an injury to a muscle or tendon, thick tough fibrous cord of tissue that connect a muscle to a bone. A muscle and a bone. It can be as simple as overstretching to a muscle or tendon, or it can be a partial or complete tear. Alright, most common of muscle strain is strain back, like example of picture. That is the most common strain that occur to the human or athlete. Alright, now sign and signal of strain or muscle strain. Okay, for a strain, we will feel pain, muscle spasm, muscle weakness, swelling, cramping, or trouble moving the muscles. Okay, like the picture that I have shown to you, the first one is strain back, when she feel pain at her back, and this is a swelling. His ankle become bigger size, and this is cramping. He feel cramp at her gastrocnemius. Okay, that's all for sign and signal of strain. Okay, that's all from me. Bye.
Assalamualaikum warahmatullahi wabarakatuh. My name is Nofarana Balkis binti Muhammad Muhammad. I'm from SR1134C. So I'm gonna explain about the causes of muscle strain. Okay. Point number one is this is because we not warming up properly. So warming up is an important thing when we want to before we want to play the sport. So the first thing we have to do is to warming up properly to make sure that our body is in a good condition to play in the sport. So the second one is for flexibility. Flexibility is important because it can help us having injury, and it also prevent ourselves from have serious injury. Okay. The third one is poor conditioning. So we as athlete, thing, the first important thing is training. So conditioning is training. So if we don't have good enough conditioning, we can we can get the injury in a short time. That's mean when you don't get enough strength in your body, you cannot lift any weight, and if you lift the weight, then it can be the injury. Okay, and the last one is overuse and fatigue. Muscle strain also can get because of overuse and fatigue. That's mean overuse is when we train so hard, and then our muscle is don't get enough rest. So when our muscle don't get enough rest and we keep using it, it can it is the causes of having muscle strain and fatigue. No, sorry. Overuse and fatigue. That means our muscle is fatigued. When we overuse our muscle, and our body is getting fatigued, and then it can easily, so our body easily to get muscle strain. Okay, so now we're gonna continue to the risk factor of muscle strain. Okay, there are several factors for muscle strain, and the first one is muscle tightness. Okay, muscle tightness happen when athlete don't have enough stretching. So we go back to the previous slide that I said that athlete should warm up properly before plays. So athlete should always rest to avoid from having muscle strain. Okay, the second one is muscle imbalance. Muscle imbalance happen when during high speed activities, which means that when your body cannot adapt to the training, and you only use your dominant hand. Okay, for the example is when we jumping. Okay, when you land, you use your right leg much more than your left leg. So it can happen muscle imbalance, and it can be the risk factor for muscle strain. Okay, the third one is poor conditioning. From the previous slide, this can be the causes of muscle strain. And poor conditioning means that weak muscle are less able to cope with stress. Okay, that means that your muscle cannot adapt to the training because of you don't have enough training, or maybe your muscle don't get enough strength. Okay, and risk factor. So muscle fatigue means that your muscle more to the injury. Means that your muscle will get easily injured. And okay, that's the last point. So there are 4 risk factors for muscle strain. Thank you.
Assalamualaikum warahmatullahi wabarakatuh. My name is SR1134C. I'm from SR1134C. Okay, I will explain you about symptoms of strain injury. So the sign and symptoms will vary depending on the severity of the injury and may include this or symptoms. Okay, the symptom is first is pain or tenderness. It is very pain. It's not just pain. It is real pain. Next is redness or bruising. So I will give you a number of picture bruise. Next swelling, it become more swell. Okay, next movement restriction or limited motion to move. Okay, muscle weakness, muscle spasm, and also stiffness. I think this muscle weakness, muscle spasm, and stiffness is a little similar. It's not really similar. In my strain, a torn muscle may feel slightly stiff, but still flexible enough for use. Or for a severe muscle strain is when the muscle is severely torn. This results in pain and very limited movement. Okay, next. Assalamualaikum warahmatullahi wabarakatuh. Okay, next is complication of strain injury. Okay, first is fractures. Or if you have a strain with a lot of bruising or swelling, it may indicate that the bone is fractured. Other signs of the bone is fractured can find when lumps and bumps, they're usually not there. For example, this is my bone and there is certain lumps or bumps. So I will conclude that this is suspect. This is fracture. My bone is fractured because this area is usually not have lumps or bumps. So it can be fractured. Okay, next, being unable to bear weight. So when we had a fracture, we really cannot lift any weight. We will feel very pain. So it is conclude that our bone is fractured. Okay, pain and last for other signs of fracture is pain or tenderness in different places. Okay, next complication is dislocated. Dislocated joints can also be a complication of strain. Okay, last, pain and recurring swelling. Okay, this pain and recurring swelling can be common complication after an ankle strain, particularly on the outer or lateral side of the ankle. Next, I added some information for you. If you unable to use or tighten strained muscle, it may mean that the tendon that attached to the muscle is ruptured. And last, if you twist your knee and feel a tearing sensation followed by severe pain, it could be a cartilage injury. So the complication is fractures, dislocated, pain and recurring swelling. Also, like what I said, it can be cartilage injury. So that's all for me. Thank you. Okay, next.
Assalamualaikum, my name is Nur Ada binti Muhammad Isa and I would like to explain about the prevention that we could take to avoid from leg strain injury. So the first one is we should have a proper warm up before we participate in any kind of sport. Why I say so? It's because a proper warm up could help our body muscle ready to be used before we perform any skills or movement in any sport. So the second one is we should follow an exercise program that aim in stretching and also strengthening our leg muscle. So it could decrease the risk of leg strain injury. And the last one is we should increase the intensity of our training program gradually. And we should not push ourselves to use our leg muscle too hard and too soon. Okay, now we move to the treatment that we should take when we had a leg strain injury. As you guys know, strain injury has divided by 3, which is grade 1, grade 2 and grade 3. For grade 1 and grade 2, the treatment that we apply is using rice roll. What is rice roll? Rice roll is refers to rest, that we should rest the injured muscle. Ice, we should apply ice for 20 minutes, 4 to 8 times per day, and it helps to reduce swelling. The third one is compress. We should compress the injured area using elastic bandage. And the last one is elevate. Elevate position is the injured limb should be 6 to 10 inches above from our heart. Okay, now we move to the grade 3 treatment. Grade 3 treatment is totally different with grade 1 and grade 2. It's because grade 3 involves a torn muscle injury. So the torn muscle injury should be repaired surgically by an orthopedic specialist. One exception is grade 3 strain, usually treated without surgery. They just need to see the orthopedic specialist and follow the rehab process to recover the injury.